naturopathic pharmacist and nutritionist, and owner here, Lionel Natural Pharmacy Health Store. And andropause is basically male menopause. I mean, men age and things don't work as well as they used to. You hear a lot about that subject, but a lot of it's not. Oh, that way. Okay. What is it? Okay. It's male menopause. It's when the Leydig cells that are in the testicles, they stop producing the male hormones, the androgens. It's called hypogonadism, and it goes with aging, or it can be from a trauma or surgery, of course, or a hypopituitary issue. Now, the pituitary is, you think of it as your computer in the brain that signals the gland to either add or turn on or turn off the gland to make the hormones. So when you measure pituitary hormones, mostly they do that in women, it's not a real good measure of how much hormone is there, because it could be a dysfunction there. It's a midlife aging, it's a gradual loss of your total drive, your enthusiasm, even love. You just sort of like don't feel like doing much of anything. Of course, libido is a big piece of it, and your total vitality, that you used to have, is kind of on the waning or gone. It also affects the mental and, of course, the physical part of your body. You just can't get up and go. You feel tired. There's a loss of muscle mass and the strength and the endurance. And a lot of times you'll see a midsection weight gain. Okay? I'll get into that a little bit later. There are hot flashes and night sweats, just like women get. You just don't know what it is. You just don't think about it, But it's there.
I thought it was the red wine.
Well, it could be that too. It's the grumpy old man syndrome. You're down in the dumps, you're pessimistic, you're negative. Walter Matthau used to play that grumpy old man thing. So, hypogonadism, the causes, it could be hemochromatosis, which is a buildup of iron. And unlike women, men do not leach out iron. They don't have a period. So over time, the iron levels go up. That interferes. Of course, certain types of diseases, AIDS, cancer, chronic disease, rheumatoid arthritis, renal failure, cirrhosis, COPD, this is lung issue, radiation treatments, and a number of medications. Alcohol and xenoestrogens. And these are estrogens that are found in cosmetics, plastics. They're used as solvents. They're in the soil. They're in the air from fossil fuel burning. They're in bovine growth hormone, which they inject animals to beef them up. And there are a number of them in antibiotics. Potentiates the antibiotic. Of course, when they use the antibiotic, you completely throw your immune system off. So that's why we have so many antibiotics that don't do anything anymore. We have a lot of resistance. Steroids, and these steroids are anabolic in a way, and fluoride, they're fluorinated. So what really upset me just the last few weeks was on television, our wonderful FDA, which I have no respect for at all, just put Nasocort, fluoridated steroid, over the counter.
What's it used for?
Sinus problems. So all it does is shrink the membranes. It doesn't take care of what the problem is. This is how pharmaceuticals work. They treat a symptom.
Yes.
Some sort of trauma can do it, like, some sort of an accident, or if you've had an infarct, if you've had a heart attack or a stroke. It's kind of the unspeakable passage of time for men. It's denial. Younger men are starting to understand that they can talk about it. I mean, just think about talking about ED 20 years ago. No, wouldn't be done. Low sex drive, the decrease in spontaneous morning erections is the first sign of it. There's a circadian rhythm to your hormones, and the morning erection is a normal thing, even whether maybe you're having a dream or whatever, but that should still be taking place. Depression, withdrawal, inactivity, there's a threat here to the image. The macho man is no longer that, you know. This is where they use other things. They get violent or grumpy or guns or whatever. You know, it's the kind of the bar feuding kind of thing. They see it as an end of their manliness. All these are kind of the same thing. Palpitations is one of them, of low testosterone. Testosterone is the hormone for the heart. There's an increased pulse rate. There's joint and muscle pain. Urination is frequent. There's a loss of force, and there's hesitancy. You know, you stand there, you can't quite get that in. How's the height? It can be constipation, decreased height, become antisocial, your focus. There's fear, there's anger, there's reluctance, there's complaints. It's just like a tired kind of feeling. Low T, connections, cardiovascular disease, it is the hormone for the heart, diabetes, arthritis, obesity, osteoporosis, cancer, depression, dementia, hypothyroidism, autoimmune dysfunctions, protein, fat, and sugar metabolism are a part of that. Things start to not work as well. Testosterone.
Digestive, you mean?
Well, you can't process your proteins or your fats, and your sugar metabolism is the easiest. So this is where you start to get the weight gain. Because testosterone regulates the insulin, along with progesterone in women. The different glands, the testicles, the ovaries, for you ladies, the ovaries, they do produce testosterone. So do the adrenals when these start to fail. This is part of the tired thing. The adrenal glands, they take care of stress, inflammation, and fluid and water. So they also make hormones, the sex hormones. So when these fail, then this takes over, and this is part of the issue with the weight, the tiredness, and not feeling good. And of course, in the conversion of your thyroid hormone to the active form intracellularly, you can measure all the thyroid hormone you want to in the bloodstream, but that does not mean that it's getting in the cell where it does the work. The pineal gland, pancreas. This is where the insulin is made. Okay, if you have too much estrogen, the insulin gets resistant, doesn't work. The pineal gland makes melatonin, the sleep hormone. It's also a cancer protective hormone. The lymphatic system is controlled by that, and the hypothalamus, pituitary, and the thymus gland, which is your immune, and the parathyroid, which is below the thyroid, which controls your calcium intake for bones. These hormones that they're giving, that you see, these commercials for low T, I'll get more into that, it's not just about testosterone. And the problem with the way they're promoted and not explained to the physician, even endocrinologists, I run into this problem, they don't understand what else happens after you give testosterone. If you look at this little chart here, maybe you can see it, maybe you can't, but cholesterol is the main hormone in the body. So what do they have a lot of seniors on? Statins. So cholesterol is the mothership, the source. From there you make pregnenolone. It's grandpa or grandma, I call it, calming, wisdom, and sharing itself to the other hormones. Green on this chart is cancer protective hormones. Progesterone goes this way, and that controls the adrenals, the aldosterone, water, blood pressure, stress, cortisol, and cortisone, inflammation. So that works on every hormone receptor, progesterone. Mostly in women is where you see it, but you also see it over here in testosterone. It does the same things. So DHT, if you give too much testosterone, you're going to have a couple of problems here. Testosterone will overflow and make DHT, which comes over here. And this is the one that causes the prostate cancer. Okay? It's very strong, very potent, makes cells divided very fast. The other thing that happens is it then goes from testosterone to estradiol, the above-the-waist estrogen. So a lot of men who are using low T, especially the gels, they'll start getting breast pain. Okay? DHEA is a balancer for the adrenal side over here. So if you're low in this, your DHEA kind of picks up. This is muscle-building, anti-aging hormones, what we kind of call it. It's a good one. Can't see the color, but I have them highlighted in green, which are cancer protective. Progesterone, of course, men need progesterone. And here are the estrogens, all right? Estrone, E1, it's just the way the structure is made, is over here. Now the problem is that Premarin has about 20% of this in it. Of course, Premarin has Equilin, a horse estrogen, that has a 13.5-week half-life, which remains in that human being for the first pill, 50% is still there at 13.5 weeks. So they build up that level. And there's 200, I got this document straight from the horse's mouth, so to speak, okay, because Premarin is pregnant mare's urine. They don't know what they are, but there's about 200 different androgens and estrogens in there that they can't identify. So, but it's still on the market. So that's estrone. That's the midsection estrogen. Estradiol is above the waist. Oh, there's too many eyes, sorry. Estradiol is the strongest. It's above the waist, brain, cognitive ability, development, the curves the girls get, the breasts. Unfortunately, they make a synthetic version which is more potent than the bioidentical that the women are making, and that particular product will immediately convert to estrone. So a person on birth control or the patches or hormone replacement that's estradiol will immediately start to get fat. Now, they also give this estradiol because they don't know any better, and it's cheaper vaginally for vaginal dryness. So the problem is it will convert to estrone and it will affect the breast, but the OBGYN will say, well, no, it's transdermal, it can't get into the system. Well, every woman that uses those pills, those inserts, end up with breast pain. And the last one should be green. It's hard to see. I'll have to change that on my coding. Down here. Now this estrogen is the safe estrogen. In women it should be about 60 to 80%. In pregnancy it goes up to 90% because it's the fertility estrogen. Estriol is used in Europe exclusively, and when we do bioidentical hormones for women, we use estriol and a little bit of the strong one, estradiol. It's called bi-S, but its ratio can be 80 to 20, or sometimes it's a little half and half, depends on what the doctor wants. Okay, melatonin and serotonin and dopamine, these are all the brain chemicals. There's insulin, it is a hormone, to help with the sugars. Human growth hormone, there's a lot of stuff about that with the injectables to lose weight. But you have to be careful because if there is a cell that will be a little bit out of whack, it will stimulate cancer growth. It could mutate. I don't like seeing anybody using that unless they're using certain doctors around here that I would recommend. Thyroid hormones are very important. They also wane. This gland here, this butterfly, will start to make less and less of the hormone. But it's not about quantity, it's about the quality of the hormone. T4 is the supply. It's like the raw material, the wood. T3 is the finished wood. Okay, that's the cabinets that you want. That's the active form. Doctors will give T4 and measure TSH, the thyroid stimulating hormone, the pituitary, and think the person's fine, but they're not converting to T3. Under stress or trauma, there's Wilson's thyroid syndrome, and that's reverse T3. T3 is the on switch to turn on the fire and raise your body temperature. Reverse T3 is the turn off switch. That's normal. Every day, the T3 gets you going, but if you go too far, you would get anxious, and it slows it down. T2 is just a precursor, and T7 is another one out there that we look for when we see these two joining each other. These two could look normal, but it could actually be fooled by the blood. It's actually that one, which doesn't do anything. Adrenals, I've mentioned those. Cortisol, stress, cortisol, inflammation, aldosterone, blood pressure, water, and adrenaline. This is when you release sugar, the fight or flight. A lot of the time what happens is in the middle of the night you'll wake up and pee, and you wake up anxious or sweaty because the brain here needs sugar to run. And as that blood sugar drops, the brain signals the adrenal, you kick out adrenaline, and you wake up in a night sweat, or you got to pee, or you're just like nervous, like worrisome thoughts kind of a thing. That is a typical reactive hypoglycemia. That's what's going on. And it happens at 3 in the afternoon for a lot of people who, are under a lot of stress or don't eat a good lunch. Oops. All right. Here is the hormone pathway. Now, only reason I'm showing you this, I have this for other practitioners and things, but I want to find testosterone. Here's testosterone. The only thing you got to look here is just these pieces right here. Now, the thing I'm trying to find, where is it? Where are we here? if you look at estrone, right here, the only difference is, see right here, there's an oxygen. Over here is a hydrogen and oxygen together, a hydroxy group. It's really the only difference. So by giving these synthetic hormones, they're a little different than these, or giving testosterone, see where they go? Right down to the estrogen. So if you don't have a customized blend, you're going to end up overflowing the thing here. And what happens is when the estradiol here gets too much, it'll dump it over to its sister, the belly fat. Now here, this was one of my continuing educations, all right? It was ridiculous. But what happens, this is the structure of testosterone, and this is what the drug companies do. They alkalize it. They put another alkali right on this point. That's for one particular type of hormone that they're using. They add junk to here so they can patent it. Here's another position they can put it, and here's a esterification, the worst of all. This is where they put the methyl testosterone together, which is very dangerous to the liver. But I mean, I had a physician tell me that the methyl testosterone was the best of all because it doesn't aromatize into estrogen. I said, yeah, but it's just turned into an estrogen, you fool. But he didn't believe me, so anyway, I didn't make a cream for his wife. That's all he wanted. He wanted her to have sex with him. This is the same chart. Okay, that's the same thing. It just tells you a little bit more about the different metabolites in there. All right. Blood versus saliva versus urine versus pituitary testing. Okay, here's the problem. Oral doses of medications will show up in the blood. Transdermals will not for a while. Urine gives you the metabolites, and if the doctor's on the ball and he knows what the metabolites of the hormones that he's using, he can determine your levels, how to be adjusted. All right? The pituitary hormones are just, like I said, these are on and off switches. It's an inverse relationship. Okay. If you're low in testosterone, your LH hormone, luteinizing hormone, will go up to try to make an empty well pump. Same with the women. Trying to make progesterone, men, testosterone. FSH, or follicular stimulating hormone, will stimulate the ovary to try to make estrogen. So if you're low in estrogen, FSH goes up. So many physicians will measure LH. It's just their routine. And FSH in women for menopause. It doesn't tell me what the hormones are. It could be a problem up here. It could be a loose wire. All right. Blood values are based on averages of everybody. You, me, he, she, this little guy, this young gentleman here. They all come into this group of what they measured, so everybody has to fit in that box, and if you do, there's nothing wrong with you. All right? Everybody needs a certain amount. We don't know what that is. We can figure that out. Total versus free. Total just means you have a supply. Free means that is another finished product that does the work. Most physicians hardly even measure anything, and I'll show you that in a minute. These are quantitative analyses. They're not qualitative analyses. So this is not the quality of the hormone, it's just how much is there. They're not accurate. So the doctor smears on these pharmaceutical creams. He measures in the blood. He doesn't see any change much. The person's feeling a lot better for 2 or 3 weeks, but it might be 3 months before he measures it again. And I've seen this over and over and over. Whoops. Back. The doctor will raise the testosterone dose. This guy's already grumpy now. He's getting a little aggravated. He's getting short-tempered. First thing I ask him, your nipples hurt. Yeah, my shirt. So he's already aromatizing to estrogen because they're using these quick, chemically made synthetic bases. Some of them are gels, which are absolutely the worst. Blood is not accurate for transdermals. Downstream hormones are not assessed by most physicians. Now, people that I would recommend you go see do that. They don't express activity. It's very misleading. Here. Physicians may not be familiar with the necessity of frequent monitoring, side effects, symptoms, and delivery of commercial formulas. I've had many times the patient goes back to the doctor complaining about the side effect of the estrogen issues, and he puts them on another drug, usually an antidepressant. All right, great. So anyway, saliva is more accurate. It's a true level of the active hormones. It's the free form. better assessment of transdermal delivery. That includes pellets as a surgical procedure, gels, creams, lotions, buccal or lozenges, and inserts or suppositories, and there's some in the nasal sprays. These transdermal forms are systemically in the blood. Serum analysis won't show the exact levels because the active is in the red blood cell, not when you spin the centrifuge, when they're doing the blood work, they reach down and they grab the serum to measure. So that's bound. Saliva picks up the red blood cell. That's a better way to look at it. Urine analysis, like I said, are the metabolites, and doctors have to know what they're doing to do that. Pituitary values are of little help in determining a dose. It just tells me one thing or another, whether or not the gland is primarily in failure. All right, that's why they go up. All right. Male serum should be somewhere between, you look at these values, 300 to 1100. If you're at 325, a lot of times the doctor won't give you any. All right? A man likes to be up around 700, 900. If you're up around 1100, you might have a little problem if you add, if you're using it and your level gets up there, because it could be a little bit of a problem. It might start to make the estrogen. The free forms, you want to be somewhere in here. I've seen some levels that are really kind of strange because it's one of those things where you start to see these numbers go up, and these numbers go up, and the person's getting worse. But then you don't look at the downstream. That's where the problem is. Saliva is bioavailable. This is a much better level. You can check it right away. You want to be in here, and the free right in here somewhere. It's a good idea to run the blood first, and then these kits here, these are saliva kits. You can do that to see where you are. But you have to check within about 3 months after you start therapy, and again in 6 months. And then maybe another 6 months, and then maybe yearly. But you have to monitor these things. Your estradiol, the above the waist estrogen, these are the values. The saliva, these are the values. Estrone, this is the one you don't want. If you start getting belly fat or breast tenderness or prostate problems, soreness, or back pain, that's where the prostate is acting up. It's estrone, okay, the beer belly thing. DHEA, you must measure the metabolite of DHEA, it's the sulfate. This is over the counter so far. A few years back, what's that old term? The wisdom of the FDA, that acronym, or oxymoron, I guess that's oxymoron, decided that this was an anabolic steroid, and they wanted it off the market. I talked to Jim Gerlach over here about it. I said, Jim, this is not an anabolic steroid, it belongs in the body, you do something about it. And one thing about him, if I tell him something, he'll do it. So it got dropped. I don't like it over the counter because you find it anywhere, because no one's there to tell you how to use it. And women will come in, I've caught them buying 100 milligrams. They need about 15 to 20. And they come in, their hair's falling out, and they're getting acne. I said, well, no wonder, I'm getting fat. I'm miserable. I said, well, what are you doing? And they're doing too much DHEA. I measure it. I don't use it too much. I use small amounts. And my women, I don't give them more than 15, unless it's very, very low.
And what's it do for you, the DHEA?
Fat burning, muscle building, bone building, cancer protection, anti-aging. All right. Oh, there it is. All right. The S in the saliva, these are the values. This is dehydroxytestosterone. This is the one that shoots over here off of testosterone. Side effects are, this is the young kid. All right, this is the 17-year-old. Does that look somewhat like prostate? Not much, but all this kind of stuff. All right, women, polycystic ovaries, fibroids, insulin resistance. So this is why a young man will be eating pizza and chips, and he'll just eat you out of the house. All right, but their metabolism hasn't changed much, so they'll be thin for a while, unless they're sitting there doing this, playing the video games. You should monitor this whenever you give testosterone, DHEA, and estradiol. PSA, Pacific prostate-specific antigen. It's a marker for prostate dysfunction. That's an enlarged prostate. Urinary flow and frequency is off. It's a precancerous signal. You have to watch this if you start any hormones. You know, if it starts to go up too quick, you have to cut back on the hormones. That's why when there's a sheet in your pack there that tells you what you should be measuring if you're on the hormones. Here is monitors: 3 months, 6 months, and then 12 months. Physical exam after age 50, and then yearly. Now this book up here, Prostate Health, you're welcome to them, they're free. Zyflamen Prostate 5LX is what he's talking about. This is a Dr. Katz from Columbia University who was using Zyflamen, which is an anti-inflammatory in arthritic men, and discovered that the prostate, a lot of that prostate problems, started to clear up. So then he switched his study to using 5LX, which is 5-lipoxylase inhibitor, which is the hormone that, it's an enzyme that stops the testosterone from making DHT. So, just a serendipity. Follicular stimulating, I think I talked about that. High FSH means low estrogen. From pituitary, males make estrogen from the testicles, adrenals, and fat cells. This is a problem. Okay, so if you see FSH, you know, the normal, you know, and he's heavy, you know this is where it's coming from. So you want to get this belly fat off. It's not active. Males, this is the level. Female varies during the menstrual period, during pregnancy, and of course, menopause, it kind of shoots way off the chart. LH is the same kind of thing. This is more of you think of it as a female, but it stimulates the testicles to produce progesterone and testosterone. If it's low, if it's higher, it means that there's low production. Lower levels, if testosterone is low, indicates malfunction of the pituitary or the hypothalamus. Higher indicates the need for testosterone. It's just they're trying to pump an empty well. Sex hormone binding globin. Whenever you give a hormone, a protector comes out. SHBG, sex hormone binding globin. It should be measured because you can keep giving hormone all you want, and it increases as you have excess estrogen or other hormones. So it's going to grab the hormones and surround them, but the hormones will look normal. They're surrounded by a protective protein. It stimulates thyroid binding globin too. Thyroid binder will go up. So if your thyroid is completely normal and the sex hormone goes up, then it affects that, and that binds up your thyroid. So what happens? You suppress thyroid activity, you get fatigue, weight gain, depression, all the signs of low thyroid. I always measure this. And thyroid binding globin when I'm treating it. I can't treat it, I'm sorry. When I'm looking at somebody's blood work, I always get thyroid binding globin. Interesting, this mineral, zinc, okay, they need about 50 to 100. This actually lowers sex hormone binding globin and estrogen, just like that. D3, very important, the sun vitamin, the happy hormone. It turns into serotonin in the gut. If you have gut problems, you can't convert D3 to serotonin. In the winter, you want to take about 5,000 units. Your level should come up into here. If you're at 45, the doctor thinks you're fine. No, get it up there. It's cancer protective. B12, now I can't prove this, but in my work, I couldn't figure out why thyroid and the hormones weren't working. And I came across an article about injectable B12. So I looked through it, and I just, on my own, started measuring B12, and I noticed those that I was having trouble with, the B12s were, 400, 500. This usually occurs in people who are not eating red meat. That's the only place you get it. So I started giving them B12. When I got this over 600, that seemed to be the average. People are feeling a heck of a lot better. Now sometimes the levels go up to 12, 1500. Doctors get all freaked out, and I said, don't worry about it. Just take, now you've got your level, go set it every day with these sublingual tablets. Go every 3 times a week. Or when you've got a lot of work to do, you pop one of these things and you'll get through that day. If you have a long, long day, you're on a plane, you're flying, and you're 12-hour day, something like that. You've got to watch your magnesium and calcium ratio. Magnesium is a relaxer. Works 300 different places in the human body. One of the most important of the minerals. Calcium is very little importance. It is not a bone-building piece. It's just there. It's the regulator of the pump of the muscle. Calcium contracts, magnesium relaxes. So if you get cramps and things like that, it's usually a deficiency in magnesium. I had a young gentleman where I work out, and he was across from me. He's doing sit-ups, and he's screaming out loud. It's I don't know if you know Planet Fitness, but you're not supposed to yell or grunt. If you drop the weights, this siren goes off, right? And you get really embarrassed. So he made the siren go off, and I said, "What's going on over there, Bob?" And he said, "Oh, I got this cramp on my side." I said, "Oh yeah? When does it happen?" He goes, "Oh, when I do this, or if I sweat, and I'm sweating at night, I'm crampy." So I said, "Come up and get some magnesium spray." So I have this little peppermint and magnesium. He sprayed it on. He was like flabbergasted, like I'm some magic guy. Right? So he got the magnesium. And next time I saw him, he said, "Oh, I can't believe it. It really works." I said, "Yeah, magnesium
Ben,
needed." Yes.
You said calcium is for contraction. Was it not? I thought potassium was involved in muscle contraction.
Potassium too. Potassium,
Okay.
magnesium, or the relaxers. Calcium is more of the one you don't want.
Potassium and magnesium are the relaxers? Interesting.
People
Okay.
have a little bit of elevated blood pressure. I give them magnesium, potassium, 3 times a day. We have a company called Thorne. It's about $12, and blood pressure will come down. Iodine, very important.
What form is the magnesium?
You want the citrate or citramate. Maleate's okay, but you don't want the oxide. That's what you'll hear about.
Right.
Okay. Now, iodine. Thyroid and estrogen balance. The thyroid gland has estrogen receptors. The ovary has thyroid receptors. Why am I saying this? Iodine is deficient globally, except for Asian cultures, because they eat a lot of it. They don't have much heart disease. They don't have very much obesity. They don't have much cancer. They don't have prostate issues. They don't have breast cancer. Their iodine levels is 100 times ours every day. All right? So, in days gone by, I'm talking about the 50s and 60s, when a woman came in with any type of fibroid, fibrocystic breast, ovarian cysts, uterine fibroids, they took the patient, and this has been done at medical school. The professor would bring a patient up with fibrocystic breast. Med students would actually touch the patient, palpitate, see what it felt like. He would do a procedure by painting the vaginal wall with iodine, draw the curtain. He would do this particular pathway about the hormones and how they break down. And half hour, 45 minutes later, he'd come back, and the patient would be checked by the medical students. Fibroids are gone. Breast cysts are gone. Okay? So, iodine is very important. There's a pathway to go from estradiol, the breast estrogen, to estrone, down to estriol. Iodine is the missing piece, and so are cruciferous vegetables, broccoli. Drug companies make Arimidex, Femera for breast cancer. It's just broccoli, but it's 1,000 times more expensive. We call it DIM. You'll see it a little later. The other thing I look at, and plus the thyroid, you need that as a raw material to make your thyroid hormone, and to add it to an enzyme called 5-deiodinase that converts your thyroid hormone inside the cell. It's like a carrier inside. So if you're low in iodine, your T4 that sits out in the blood looks normal. It can't get in. That's a piece of it. Ferritin, very important. That transports iron. So if the levels are over 200, this is men, they don't menstruate. They get tired, increases risk for cancer. This is the hemochromatosis, okay? Post-menopausal women, hysterectomy, and males have this go too high, but you want it to sit right around here. Give blood. That's all you do is give blood, it'll go. Or you can do a couple of tricks. You can take wormwood to get it out, but that stuff gives you a lot of gastrointestinal problems. Eugene Shippen, he is the testosterone dude, all right? He's right up here in Reading. Or Shippensburg, I think is where it is. Shippensburg. The biggest hurdle for many physicians is making the decision to initiate treatment, even simply to test for deficiencies. He's so right. This book was written 20 years ago. I truly believe that there are no side effects reserving for the replacing of your personal normal hormone status. There's only the return of healthy body functions. Okay. He knows this hormone belongs there, and he fills the gap. Say if you came up at 450, he'd bring you up to 600 to 700. You put on test 10, or the worst of them, the axiom under the arm, you'll go way up there. You'll feel great for about 2 or 3 weeks, and then it happens. This Wednesday, because of that one study, consider whether testosterone is being prescribed to the right people. Now, how can the FDA determine the efficacy if they are not reviewing each individual history? Right? Here's the statistic. 2.3 million in 2013. 70% of them were aged 40 to 64. This is FDA data. 21% had not been tested prior to the prescription. 50% of the users had no signs for the need of it. It's their own data. $1.04 billion in sales. This is the key to the FDA action, which will be nothing. Public Citizens Watchdog Group petitioned the FDA to immediately add a black box warning. FDA said, I ain't going to do that. FDA, not enough data and additional studies needed. Restrictions on marketing and promotion, but doctors still can, look at this, oh, you can still prescribe it. Right. Okay, here's the study they're talking about, they're worried about. November. Prescriptions of testosterone were given to 8,000 senior men 65 and older. The dose was not custom compounded for the individual. Everyone got the same dose. The dose was continuous, no break. This is very important, right here. Every day. Each individual had previous heart attack or a stroke. Downstream hormones, estrogens, were not measured. Nothing was measured. There was a 29% increase in stroke and infarction and death. Okay? They already had stroke and heart attack. It had nothing to do with the testosterone. The problem is probably this study, is like what the media wants to see. 2 additional studies found significant reduction in overall mortality associated with testosterone therapies. That's 2 recent ones. There have been literally 100 of them done with testosterone. They started using testosterone, and you'll see it later in 1950. You know what Rocky Mountain oysters are? You do?
Is it buffalo?
Huh? You do.
Testicle.
You've eaten them.
Somebody's testicle.
I only liked it.
They're goat's testicles. They fry them up.
Yeah, testicle.
And this started back in the Greeks. They would, get their testosterone. Right? All right. Jonathan Wright wrote an article, a very lengthy article, testosterone. Hormone of the heart is testosterone. So his questions are, which hormone builds muscle? Testosterone. What is the most important muscle in the body? It's the heart. What's the average age for heart failure when the testosterone goes down? 50 starts to be a risk. Which hormone enhances blood vessels? Stronger, opens, closes. Testosterone. Which hormone prevents diabetes? Testosterone. Which hormone enhances fat burning? Gee, am I making sense here? Vitality, cancer protection. It is a cancer protection hormone. Prostate cancer is not a testosterone-driven condition. It's a hormone. It's not. Otherwise, 17, 15-year-olds would all have prostate cancer, right? It's the estrogen that's starting to, it's the lack of testosterone and the increase in estrogen. Builds bones. When do they show signs of depression? Obviously, they're older. And dementia. There's a whole bunch of other benefits. We can go on and on. Forms of testosterone, the bioidentical human, are capsules. They're not that good. But there is a company, when I was reading this article a few minutes ago, that I showed you about what the FDA was going to do. They're about to approve an oral form, which was around in the 60s, I believe. But nobody really knew about it. It was mostly for people who were castrated. But it's not a good delivery, because if it goes right to the liver, then it can be a problem. They're quick release, so you get a poor delivery conversion problem, and there's ups and downs in blood levels. We do make a slow release, as a couple of physicians make a slow release testosterone, get even blood levels and less of a liver issue. But it does orally, the hormones will increase sex hormone binding. Troches, I don't use these much. These are lozenges you put between a cheek and gum or under the tongue. They're a little bit irritating. They ought to be flavored. They dissolve slowly. It takes about 5 minutes. They are quick in the saliva. So if you're ready for the event, as I say, you can pop one of these and, you know, about 20 minutes or so, you're like, hey, come here, you know. They're expensive and insurance coverage is iffy. You have to refrigerate them. I've mailed them before and they melt all over the bag and I have to redo them. It's a pain in the neck. They work well for individuals who have previously been on synthetic hormones. This is females, you know, when they use estrogen and progesterone. They work beautifully for people who are on long-term Premarin or one of those others. The blood levels are reliable because this is, again, transdermal, so saliva is best. Injectable. Now, Dr. Shippen likes this. It's an intramuscular injection. It's a little inconvenient. You got to go to the office. It could be costly for them to give it to you. Insurance coverage is hard. And it does hurt, you know. After a while, it's sore for a while. You can control it pretty well, but they usually give it twice a week. The injectable has been around a long time. The only problem I have today, where are these things made? It has to be sterile. And you know, if you hear news stories where there's a lot of contamination. Because of compounding pharmacists getting into trouble making compounds, and that I don't consider that person a very ethical compounder. There's 2 of them that got in trouble because they were just running a shop in filth, actually. So getting a sterile approval is very difficult. We don't do them. We just, not in this building anyway. I'd have to have a clean room. And so far I haven't had to go that way. You can control a little bit easier. The physician has to know what he's doing. You have to monitor him for conversion of the other hormones. Pellets. Now these are great. Women have a little trouble because they put estrogen in, and that can be problematic if you don't have the right guy doing it for you. There's no daily dosing. They last 4 to 6 months. They're lower dosing per time frame. So in a 6-month period, you'll only get about 1,000 to 1,200 milligrams. These creams and patches is 50 milligrams every single day. So in 6 months, you could be up into the 5,000 to 6,000 milligrams, you know, of testosterone. It is surgical. It's expensive. Insurance will not cover it, and you have to monitor it. You must have a physician. I only recommend one person to do this. Okay. Oh, maybe Shippen. He might do these too, but he's not in our area. Once it's inserted, once you have your dose in, and if somebody knows what they're doing, you're stuck. You can't get it out. I've had several female patients come in, and they got a little too much. And that was not a problem. Oh, my guess came down to here. Transdermals are lotions, ointments, gels, and creams. Lotions, that's old school stuff. And you could probably get some of this on the internet sometime. These lotions, you don't know what is in there. And it smears around and it's messy. You may get delivery, you may not. Most lotion preparations do not provide accurate dosing. They may deliver too much or too little. They don't use inert natural bases. They use the typical cosmetic bases, which are solvents, which are estrogenic, and they can go in quick or they can get trapped. If you start to work out and something's trapped in the fat cells, and you'll get a big surge of it, and all of a sudden it's gone. So it's kind of one of those things. They use synthetic hormones a lot in these particular forms, and they can get into your partner and laundry. You know, that's very, very critical there. Absolutely must do saliva. Ointments. This is an old school thing. There used to be a kit. We get a testosterone kit. It was for lichen sclerosis. This is a female genitalia. It's a lesion, a sore. They use it short term. Now, Oprah Winfrey had the doctor on, and I'll never forget because I was at a seminar. It might have been 92 or 3, somewhere in there. And they called and said, I said, how things going? It was before Mike was working here. Oh, it was more than 93. It doesn't matter. But anyway, they called me from the summer and says, hey man, we're getting these faxes over for 2% testosterone cream. The book was called The Hormone of Desire, right? And Oprah had her on. And the whole nation, all the compounders, they went nuts. So we started getting prescriptions in from OBGYNs with 2% testosterone. I couldn't get into the doctor on the phone to tell him, you can't, this is not for, this is the wrong strength. It's a high dose. It's about 50 milligrams. Women should need 5, 2, maybe 10, but 50. And it's an ointment, so it stays right there. It wasn't long, and people were coming in because these little kits that you can buy from your wholesaler, to mix it in Vaseline, give them the jar, and the women would put it on, and they feel real good, oh yeah, come here, honey. But what happened was, it was like disaster. This is what happened. Face and body hair falling out, baldness, their voice started to drop, acne. And that little area down there that's your trigger grew. And it did not go back to normal. It was like a mini penis. Okay? This is what happened. Completely off. It was terrible. All right? So anyway, I got my foot in the door to OBGYN group in Chester County. Says, you guys got to stop this. This is not the right thing to do. It's only for lichen sclerosis. Like a week. Anyway, I got my foot in the door. I did a talk down there on bioidentical hormones, and some of them, well, because I was feeding them, they came to the lecture. It's the only way you'll get a doctor out. Okay, transdermal creams are the best. Accurate dosing of a syringe. I didn't bring one over, but I put it in a 1 milliliter, 1 ml dosing syringe. And it's very concentrated. Each syringe, 1 ml, is going to have between 20 to maybe 5 doses, depending on your dose. And the amount you put on is just a dollop, very, very small amount. And it disappears right away. High percentage of absorption, bypasses the liver. The base is hypoallergenic, it's concentrated. It's rapid absorption, no transfer or delay. We don't do the sterile pellets. That's the preferred way. And I don't do it in a jar like some other guys out there doing that, or compounders. I've seen people come in with these jars and they say, well, how much are you putting on? Oh, a little bit. A little bit. So how much is, And again, they're working on percentages rather than milligrams per dose, So, a 5% cream, 1 gram, which is 1/5 of a teaspoon, okay, if you think about that, how much is that? Well, that's 50 milligrams. That's but did you get 1 ml, or did you get 3/4, or did you get 1.5? Or you just didn't care, it came out, just put it on anyway. So anyway, that's not a good way to do it. Oh, these are testosterone antagonists, estrogens. Soy, cosmetics, pesticides, solvents, estrogens in the water supply. They're there. People have hormones. They go into the water. People shower. Maybe you don't drink it, but you do wash with it. Nanogram is a millionth of a milligram. You might get 4 or 5 milligrams. A plastic bag. Oh, we didn't have it up there. A little lunch bag has 9 nanograms in a plastic bag. So if you take your lunch and it gets a little bit heated, you're going to get 9 nanograms. Back there, I left you a little surprise. Back there is, I did this morning. I went over to Dunkin' Donuts and I got a hot coffee in a styrofoam cup and a bagel. And the gal gave me Splenda, Equal, and what's the pink one? I forget. Those
Sweet and low.
They're estrogens.
Oh.
So this is the most toxic thing you could ever do, and then eat a carbohydrate, which is a probably genetically modified bagel, right? That's all estrogen right there. People do this every single day. So, NSAIDs. Any women who takes these, Aleve or ibuprofen, for PMS, it circles the estrogen back through the liver. So it does reduce the inflammation. You don't care about it, but your PMS will last 2 weeks longer. You just don't care. Antibiotics, antifungals, notorious. Statin drugs, they increase estrogen and drop your testosterone. Spironolactone is a diuretic, and I use this in women who get the acne and they have too much testosterone or DHT. Saw palmetto you use for benign prostate hyperplasia. That will do it too. It doesn't affect men too much, but I have used it in women. Antidepressants, all the antidepressants do this. Antacids, Prilosec, Anzin, Nexium, Protonics, they all create a low testosterone. Cardiovascular drugs, right? Now, just think about this. If we balance out your testosterone, would we need a beta blocker, amiridone, Coumadin, calcium channel blockers? Probably not. Correct the right balance. Alcohol, this is a big one, right here. Because it blocks cytosine P450 pathway in the liver. You can't convert your testosterone to the active form. This is what you see, and you see the beer belly. You know these guys, they talk a lot. They don't have any testosterone. Right? Hey baby, come over here, I got something for you. Yeah, what do you got? A big fat belly that I'm going to go around on. All right, marijuana, cocaine, amphetamines. It's the belly fat that makes the estrogen. A deficiency in zinc, deficiency in magnesium, these two deficiencies are easy to correct. Okay, slid a little bit. Okay, the enhancers. These are herbs. Tribulus, maca, yohimbine. I got them in red because they will raise your blood pressure. The Incas used maca all the time. The runners would chew this, or if they could find cocaine, they would chew this, and they could run forever. It's in a lot of the libido-enhancing products. Got to be careful if you have blood pressure problems. Horny goat weed. Mura pruma works very well because it helps the Leydig cell make the hormone, if you can make it. Damiana increases circulation. L-ornithine is an amino acid that dilates. Yohimbine is very similar to maca. Damiana leaf, oh, I guess I put it twice. Garlic, believe it or not. Nettle root, red clover, zinc again, selenium, ginseng, chase tree. Chase tree berry, they use this for chastity. So this was, when you use high doses of this, it would make the monks not be so active. All right? So that's why it's called chase tree berry, but it will help. Tensophora, velvet deer antler, believe it or not. We have a product with velvet deer antler and maca together. Everybody I've given it to comes back smiling. Right? And aromatase inhibitors, chrysin, which is in broccoli, calcium D-glucarate, and DIM, another one, a broccoli product. DIM, diindolmethane. Now these are name brand products. Okay, Pandan is one of my favorite ones. It's for everyday use and event. It will work. Peak for him is like a vitamin for males. It protects the prostate, it increases your libido, enhances your muscle, burns fat. It's like your vitamin. Viromax is another brand. Steel Libido is another one. Be Vital is the one I told you. That's the maca and the velvet deer antler. Ultramale T, Simplex M. This is one that works on an imbalance. This is from Standard Process. It takes a long time to work, but it's not going to, you won't even notice anything. It's just going to be 3 to 6 weeks before you start to notice, but it really works. And then Libido Stem M for male. There's also a Libido Stem M, and there's also a Peak for her. A lot of women come back smiling when I give that to them. So do their husbands. Kale, very important, not just for the girls. Discovered by Dr. Cable in 1950, contracting the muscles to stop the flow of urine, squeezing anus, lifting perianum. You should do this. It strengthens the muscles between the ani and right where the genitals are, men and women. And this, I know, you're going to laugh. Boinking, right? Where'd that come from? All right. That's the male who gets up in the morning and he stands there looking like a fool in the mirror and makes his penis go up and down, all right? Flex the penis, all right? Put your towel on it and go take a shower. All right, so it's the muscle group, the sling down that you're trying to do, the hammock, the levator, ani, the pubic tail to the bone. That's where it is. controls urine, bowel, and vaginal tone. The penile chambers of the corpus callosum, that's how you have to dilate. And I forgot to put up arginine. Arginine you can use for blood pressure and heart, and it also will help fill this, help you dilate. It's an amino acid. Only problem is if you have any type of herpes at all, cold sores or things, you have to take lysine with it because it will feed that particular virus. All this control is dependent upon testosterone. Helps strengthen the muscle. Again, muscle, back and forth. Okay, we make slow-release capsules upon request, usually not. We don't use gels. One doctor does. You can't convince him otherwise because it will aromatize, switch to estrogen. Lotions are difficult. Troches went over. Only use it usually for people who can't absorb through the skin. A lot of very, very thin gals don't have a place. Here are the sites. You see this red zone? I had to tell another patient today, you never put that pubic bone to chest bone. Not in here, not where there's fat. You don't want to go anywhere near there. The thigh's good. The vagina, the labia for women. The scrotum, it's a little dangerous there. You'll get sore if you put it there. You put it on the leg. The soles of the foot are one of the higher absorbed areas. But who wants to check it on your feet? Because you got to put your socks on to go out. You can put up here in the carotid. It's very quick. If you're using that for an immediate effect, fine. You only usually use progesterone there. Scalp, I don't know why you won't put it there. Axillary, this is dangerous. Now this axiom, this is one I was talking about earlier. You see the commercial the guy's putting it on? Why on earth would you put a hormone next to a lymphatic tissue? That's the one that probably is going to have problems. Insurance coverage, it is a prescription filled in a pharmacy by a doctor. It should be covered. We just don't bill them. They require a doctor, licensed pharmacy, and we maintain that triangle, physician, patient, pharmacy. I cannot give you the hormones without a doctor, and I always feed back to the doctor. We have a good relationship with several of them. If the patient feeds to me, doctor's too busy, I get the information, I go back to the doctor, or I'll write up a letter, a note, so-and-so is doing this and that. And I follow people all through this. Just remember, the raw material that I'm using, the doctor may question this, it's not FDA approved. Good thing. Active ingredients, hormones are FDA approved for compounding. The ingredients. Okay? I'm not a manufacturer. I'm making a special thing for you, you. These, all of you will have a different dose and a different way of getting it. But it is FDA approved. I couldn't buy it if it wasn't. All right. I usually like to do a consult, my self-program, breathing, elimination, saying no, sleep, supplements, exercise program, lifestyle change, and food. Then, that's the simple survey. There's a bioidentical hormone survey. There's one for women and one for men. I'll do a blood analysis or a saliva kit. They're free. If you want one, they will charge you for it. It will come back to me. I will read it for you. You make an appointment, I'll come back and read what the results are. They're right there. If you want them, you can take it with you. I just have to sign it. Put something on. Here it is. All right. So this is not photoshopped. All right. Guys will do this. All right. I don't know. I'm about his age or maybe older, but I look something like that. No, I wouldn't want to look like that. You know what I mean? Okay, pricing. The average wholesale price, what the wholesaler charges me if I bought the big pharma hormones, testosterone. 1 month supply only. Look at this. That's how they all, look at that, how they're all just about the same. What are you going to get? Oh, I'm going to get this. Oh, I'm going to get this. Oh, I'll move mine up. You move your up. Okay. The actual dose cost of the different items are in your packet. All right? I didn't want to put it on the screen. I don't know what the retail is. This is the wholesale price. Most insurances won't pay for it. Maybe they will. I'm not sure. Our retail price to you is much less than half. It's really right now, this very moment, it's probably only about 35 to 40% of the retail of the wholesale. The reason I put this is because I may do this again, and I think there's going to be a little problem with the testosterone. They're probably going to raise the prices, the raw material, so I'm going to have to raise the price. So it's expensive? Yeah. Consider, well, if it's $4 a day, and you use it 25, here's the thing, you should only use it 25 days a month. 5 days a week, or 25 days off. Because otherwise you start to ramifice. If you use it every day, you're going to have problems. Doctors will not tell their patients that. So how you get started, you do your homework. Consider a private consultation. I will do everything. Talk to your practitioner because you want to do your homework. Because they're not going to know. I have a list. You firmly request the lab work. You hire a doctor to work for you. Just like if a plumber came to your house and screwed it up, why would you stay with that same plumber? They're no longer the physicians they used to be. They are still out there, physicians. But a lot of them are just hospitalists. And that term means they work for the hospital. They filter people to the hospital. They don't have time to individualize the individual and find out what's really wrong. It's not a holistic way of doing it. They have a lot of cures, and the cures are based on the numbers that they put you in, the brackets. But they don't heal anyone. Not anymore. Not the young ones. I'm being critical because obviously, I've been doing this a long time, and I got away from putting the pills from the big jar to the little jar and sticking on the label and telling the person, here, it's $9.99, $9.98. Anybody can do that because the person's not getting the information, not anymore. It's just the officers are turn them out. They don't, you may go there and be at the doctor for an hour, but how many minutes does that doctor eye-to-eye contact with you? Unless you have a really good physician that is working with you. So you need to be forceful. If they won't work with you, there's plenty more. We got a list back there if you want it. I will work with them. Mind them if they're FDA approved. I won't customize them. And I always use the least amount that works. And you'll get to understand it. This is part of a learning process. Give them whatever information you want. And like I said, we have a network. Blood work, it's in your packet. These are the things you should get before you go on the hormones. You just don't want to I didn't put DHEA sulfate in here. I just forgot. But I usually don't use that one too much. As one of my colleagues, Dr. Bazan, said, what about DHEA? He says, you're using a BB gun, DHEA. Let's use the shotgun. Let's get this thing on the wall here. The DHEA is much weaker. Now, I do see some with less, Questions? Anybody?
You said that calcium channel blockers are antagonistic.
Yes.
Well, how does that work?
Well, you ought to see the structure. It's an enzyme that gets blocked by the channel blocker. Okay? So you won't be able to make the testosterone if you have some to make. It can't get in the cell with the channel blocker. It's like a beta blocker. They block things. It's like putting up a gate saying, now you can't come in here. That's why you use a channel blocker, you block the stimuli for the blood pressure.
Right.
All right? So that's why you don't go off of them real quick either. It's like a beta blocker. You can't stop taking it. Or it'd be like opening a corral and you got a stampede. You'll get a stroke. Right? That's why. It's just one of the side effects.
So if you're on a
But I don't know.
blood pressure medication, like I take ACE inhibitor, is that
Not a problem.
not a problem? You stay with it even though this is helping the...
Well, it may be. I never tell me to stop any kind of medication until you start seeing that your blood pressure is regulated. Then you taper off, maybe, and then you don't need it. Just like a lot of the diabetic patients, as soon as they lose the weight, get their energy back and start exercising, then they cut their medicine back.
Right.
The blood sugar comes down.
Sure.
That's why not? Because a lot of these cases, it's diet, basically diet and exercise. And that's why my thing is elimination. Not only going to the bathroom, I don't mean just that. Some people don't, they don't go enough. I mean, the train goes in, it's gotta come out. I mean, so 2 or 3 times a day, something should be moving. I have some, usually females, they go, well, yeah, no, I'm not constipated. I go, when did you go? Well, I don't know, yesterday, day before. You know, no, that's constipation. At least once a day, maybe twice. You see that in eliminating certain foods, eliminating that guy in his body, or eliminating visiting your mom, you know? Because that cortisol hormone, the stress hormone, goes up under stress, and that blocks everything. And that makes you miserable. So, yeah, it's you got to get back to what we call homeostasis, balance.